Hi, I'm Mark Bayley. A really common question that we've heard is, how do I decide whether a patient should engage in telerehab or in-person rehab? Here's an algorithm that we've developed which can guide you, presuming of course that your patient or client is open to the idea of trying telerehab. The first thing to consider is the nature of the treatment being offered. We split it into two broad categories. The first, rehab related to physical tasks, such as helping patients to transfer and ambulate or to perform activities of daily living. And two, rehab related to communication, cognition, or where the focus is on counseling patients to self-manage or monitor symptoms, or to support their mental health. So let's turn our attention to the left side of the algorithm. For rehab related to physical tasks, the next question to ask is whether there will be caregiver support for telerehab. Caregiver support can be very important to maintaining safety during telerehab and for assistance with some therapeutic activity. If caregiver support is not possible or available, then the next question to ask is whether there are any safety concerns with telerehab, whether the treatment or the environment can be modified to achieve the patient's goals while maintaining safety, or whether the patient truly requires in-person rehab. Additionally, some patients may require treatments such as functional electrical stimulation that may only be available in person. If the answer is no, then we can try telerehab. If the answer is yes, then they should be prioritized for in-person rehab. There's also a category of patients for whom a hybrid model could work, where they start off with in-person rehab, then as they become more physically capable, transition to telerehab at home. So let's turn our attention to the right side of the algorithm. For rehab related to cognition or communication, again, the question to ask is whether the patient needs assistance to participate. For example, a patient may be unfamiliar with technology and need help logging on to their computer, or have cognitive communication or visual deficits to the extent that they need frequent redirection and assistance from a caregiver. If they don't need assistance, then they can proceed with telerehab. If they do, then it depends on whether they have the assistance available from a family, friend, or caregiver. If they can get support, then telerehab may be a good option. If they can't at all, then they will likely need in-person rehab. Another option is to do in-person rehab first and use the initial sessions to help the patient get acquainted with using technology or improve their attention such that they can participate in telerehab later. We hope that you found our video on how to choose between telerehab, in-person rehab, or using a hybrid of both helpful. Thank you very much.